Maine is not the oldest state in the Union. Maine was actually the 23rd state to join the Union. But when you talk about the age of its citizens, Maine is the oldest state in the country.
And you would think we would therefore have the most robust elderly care facilities in the country, right? Wrong. News Center Maine's Jackie Mundry has been following this issue, watching elder care facilities close down one after another, and took a deeper look into this problem for us. Jackie?
Chris and Cindy, 4 of Maine's 94 facilities closed just in the last month. Maine is in crisis, and the fix is complicated and costly.
I think everybody tried to do what was best based on COVID protocols. But we know our mom.
Sisters Brenda Pollock and Sharon Ayer have been trying to move their mom to a different care facility.
I don't know how many wait lists. I don't know how many. And quite frankly, I don't expect to hear from any of them.
What they found is there are too many wait lists and not enough facilities in Maine.
I've talked to so many facilities, and that's the underlying thread, that there aren't enough people working in this industry.
Staffing is by far the number one issue.
State lawmakers and experts in the healthcare industry say the lack of workers is for 2 reasons: burnout and the vaccine mandate.
COVID, by the way, has wreaked havoc with this workforce. Like, lots of workers have left before the vaccine was even around because it was too hard, emotionally draining to watch people die.
Add to that, Maine is now requiring healthcare workers to get vaccinated, and some workers would rather quit than get the vaccine.
But if they lose just one, and they will lose just one, they'll have to close.
For the long-term care facilities that manage to stay open, there are fewer people working there, but they are still caring for the same number of residents, which means it may take longer for someone to get the care they need.
I kind of feel like the bar is set right now at a survival. So we've helped them to survive another day. Yeah. And I feel like the bar should be at aging with dignity.
Well, frustrating for families.
And truly, I don't blame the people who are working there. They're the ones showing up and doing the work.
Another problem is the pay. Maine Council on Aging Executive Director Jess Maurer says the long-term care workers are taking other jobs where they can make more money.
You have a workforce problem, that's one. You have to pay people competitively, that's 2. And then you have to incentivize people to take the job.
State legislators Jessica Fay and Jeff Timberlake say this isn't a partisan issue, and help is on the way.
I think we're on the right path.
That path includes a number of bills making their way through the Maine legislature, including increasing Maine care reimbursements to facilities and allocating money to pay employees more. And it's not just funding at the state level. Republican Senator Susan Collins and New Hampshire Democrat Senator Jeanne Shaheen led a bipartisan push to increase federal funding for long-term care facilities.
This funding can help offset the losses that nursing homes have had due to the pandemic.
The funding may be coming too late.
If that's true, and these changes are too little too late, it will take a lot longer to open new facilities with enough capacity for Maine's aging population. With a long-term solution in mind, educators are working to provide more trained caregivers.
Institutions in the state have added capacity, have added more seats through funding and through support.
Hundreds of families across Maine are finding out about the elder care crisis, the same way Brenda and Sharon have.
We didn't realize it wasn't part of our life. And then when we got there, we were like, there has to be better. This can't be it.
I just want her to age with dignity. And I think all older people should have that opportunity. So I want something to change so that we can give them the life that I feel like they deserve.
Chris and Cindy, as you can imagine, this is very emotional for a lot of families who are dealing with this. There are resources for families who may be in similar situations on our website and mobile app.
Jackie, thanks very much.